cholinergic drugs. These drugs stimulate the parasympathetic nervous system, and they are the parasympathetic nervous system opposes the sympathetic nervous system, so in some ways the actions are opposite. These drugs are also known as cholinergic agonists or parasympathomimetics. These drugs mimic the effects of the parasympathetic nervous system neurotransmitter acetylcholine. The effects of these drugs are basically rest and digest. The mnemonic to remember many of the drug effects of these drugs is sludge, salivation, lacrimation, urinary incontinence, diarrhea, gastrointestinal cramps, and emesis. These drugs increase salivation, so they can be used to treat dry mouth, which is also called xerostomia. These drugs cause lacrimation or tearing in the eyes, increase tear production, so it can be used for dry eyes. But it also causes miosis, which is pupillary constriction, and it reduces intraocular pressure, so it can be used for glaucoma and some intraocular surgeries. Now, the adverse effects usually associated with using too much of the drugs is that too many tears. You have tears running down your face, or loss of binocular accommodation. That means the loss of the ability for the two eyes to work well together. Urinary incontinence. Well, these drugs stimulate the bladder, causing increased urinary frequency, increased tone and motility of the bladder, and the sphincters relax, allowing the bladder to empty. Uses for this drug are urinary incontinence and post-surgical atony of the bladder. All right, the diarrhea, gastrointestinal cramps, and emesis portion of the mnemonic. These drugs stimulate the intestines. They increase the tone and motility of the GI tract. The sphincters relax and allow the GI tract to empty. And there's also increased gastric secretions and increased GI motility. Again, we can use this for post-surgical atony of the GI tract. The GI tract's not popping back after surgery and is just staying there with no peristalsis, so we can use these drugs. But the adverse effects, if we get too much of this drug for the individual in this system, we're going to have nausea and vomiting and cramps and increased secretions. These drugs also affect the cardiovascular system, causing a drop in heart rate and vasodilation. Well, the adverse effects with this is maybe we drop it too much. That's bradycardia. And maybe we drop the blood pressure too much because of the vasodilation. Then we get hypotension. There's also some conduct abnormalities, heart block, cardiac arrest, that kind of thing that's associated with these drugs. Within the respiratory system, they cause bronchial constriction and narrowed airways. In general, we don't want that. There's very, very few, if any, reasons we would want this to happen. And we're looking at bronchospasm as the adverse effect. And also we've got some increased bronchial secretions going on. The skeletal muscle system, the skeletal muscles contract under the influence of these drugs. So they can be used to diagnose and treat myasthenia gravis, And also, we can use it to reverse the neuromuscular blocking agents that we talked about in the anesthesia portion of this class. Remember the things that paralyze you? For surgery, well, these drugs can be used to reverse those agents. They also cause increased sweating. That may be unpleasant. It's rarely dangerous unless we're looking at fluid loss, massive fluid loss, and some of the other adverse effects, not necessarily associated with sweating, but associated with all the increased secretions that come with these drugs, is salivation, perhaps too much salivation. We have people complaining of headaches, dizziness, and convulsions. All right, nursing implications. Keep in mind that these drugs are going to stimulate the parasympathetic nervous system and mimic the action of acetylcholine. Doses should be spread evenly apart to optimize the effects of the medications. Overdosing can cause life-threatening problems. So patients shouldn't be messing with their dosage unless they're talking to a physician or another healthcare prescriber. When cholinergic drugs are prescribed for Alzheimer's disease, be honest with the caregivers and the patients and let them know that the drugs are for management of the symptoms and are not going to cure the disease. Also, the therapeutic effects of the anti-Alzheimer's drug might not occur for up to 6 weeks. So they're taking this. They might not see any changes for up to 6 weeks. Atropine is the antidote for these drugs if they should get too many. So it should be readily available when we're giving cholinergic drugs to people in the hospital. And we're going to monitor for therapeutic effects. Alleviation of the signs and symptoms of myasthenia gravis. In the postoperative patients, we'll see decreased GI peristalsis. So we should be able to hear increased bowel sounds, note the passage of flatus, and the occurrence of bowel movements. In patients with urinary retention or a hypotonic bladder, urination should occur within 60 minutes of receiving these drugs. Also, as always, we're monitoring for adverse effects.